I'd like to introduce the next speaker. That's Dr. Neil Pande from Nepal. He has been in private practice in Kathmandu in Nepal for the past 24 years. He manages 2 successful practices, and his areas of interest is restorative dentistry as well as implantology. He is the current founding president of the Nepalese Society of Implant Dentistry. Young and dynamic, and one of the leading faces of dentistry in Nepal. Welcome, Dr. Neil.
Thank you, Dr. Puneet. Thank you for that opportunity to do this, area, South Asia, where almost 2 billion people live. And I hear almost 3 lakhs dentists are there. And to be able to come out with some kind of synergy between the neighbors, this is a beautiful thing. And I think it's a great start, and COVID actually brought us together, and online could be made so much possible. And thank you for giving me this opportunity. First of all, now, as all of us, COVID actually woke us up, all of us, in a different way. We dentists, in a way, if you look at it, have always been bathing on that aerosol. We knew about that aerosol. We knew about all the infection control, and we did practice that. If you look at between the medical care sector and ours was always masked, and other protections were PPE. We used to call it, in England, whenever I was doing my membership exams, and PPE was that. Now this is added PPE, the aerosol issues that COVID has woken us up, which is actually great opportunity for dentistry to upgrade, I would say. Yes, we are having hardship, but we are protecting ourselves now for the next thing that is going to come. And thank you to our Dr. Irfan and Dr. Gopi for highlighting so many areas. I'm going to go on that again. Mine is a story that I have faced myself. So this is my own story. Now, this was a virus which was 500 to 600 times smaller than our human hair. And we had a main challenge. Can we work within 6 feet distance? Can we have a aerosol non-producing procedure? Very much not possible in dentistry, right? And our mask, for a simple surgical mask, which we know today protects others, but does not protect us. So there were barriers, and even the N95, which is 0.3 microns, it can prevent, and the virus we're dealing was 0.125 microns on average. And fomites, of course, we were always cleaning up with spirit and all that. We were doing all that. And thank God, COVID is not that strong, that thing, but at least it gets killed, denatured by a simple thing like a spirit. 70% alcohol. Going to, like all of the dentists around the world, we started our own thing. Now, what is it? We dentists sometimes tend to think we know everything, right? And we started finding out various things. Sometimes we even started cutting that mask and checking out how it is. We even fitted our own ventilation system, PPEs, and guidelines, and webinars, and whatnot. But whenever it comes to specialization, I feel, and we always have been practicing in dentistry also, if you have an endo problem, you may want to refer to an endodontist, which is complicated endo, you may want to refer to endodontist. Similarly, this complicated problem needed a scientific solution. And what I did was I went more towards figuring out my airflow, figuring out my workflow, and approached an HVAC engineer and architects to actually figure out, hey, how to get rid of this aerosol. Of course, mask was always a problem for us. Like Dr. Irfan said, we were not getting FFP2 or even FFP3. FFP2, what we're getting even now is only one we get, that is BYD, which is NIOS certified. Rest, we don't know if they're working or not. So we are all still in a lookout for FFP3, which has been a guideline in the United Kingdom and other countries. So My aim was to make my two rooms very negative pressure, at the same time donning and doffing separate areas, and reception segregated from the entire clinical area. So what I did was I started working. So we made the system from Ukraine. We fitted this with an aim to do that. And thankfully, last around 10 days ago, we finished the whole process, and we actually this whole webinar pushed me to get it fixed sooner. And I feel a little more safer. I feel my staff feels safer. That is most important thing. And who are we making? Patient, staff, our families, and even the surroundings safer. So even the air that goes out from these negative pressure so-called units have to be filtered, have to be UV light things, so that nobody outside also gets it. So what we did was we just made a simple process, and this process now, Hashid will go on with a video. He will just put on the video for me. I will show you the process, what exactly I did. Hashid, no, that's my video. I haven't started the video. This is just a preview only. Can you start the video from your side? So what I wanted to show you, what I want to share with all of us here today is what I actually did. Maybe there are a lot of things I am not being able to get in my head, but my always thinking was aerosol, aerosol, aerosol. Get that bloody thing out of the room. Get that thing away from us. And the airflow. So whenever we make the airflow needs to be at the floor level, not at the higher level, because whenever the air is flowing more towards the higher level, you are supposed to be getting in inside your nose. So naturally, lower level will be better. And that was complemented by all these COVID wards that were made and all that. That also did the same thing. Hasib, can you please play the video? It's still in the thing. Yeah, it's running now. Are you running it? Yeah. So anyway, let me go on then. You have to give me grace time for that when you on that, okay? Because I had taken the video out from my presentation, so that I'll see you play that. So anyway, aerosols. What we've done is simple processes, the triazing, and I've used some kind of online forms and screening and tele-dentistry. All that has been employed. One thing I've noted in a lot of our practices around is people are wearing PPE, people are doing all that, but they were actually not changing the PPE. So that is one of the things that I wanted to highlight. Oh, they can't hear me? Okay. Great. So donning and doffing, I mean, this is a boring procedure for most of the people because you've been doing that, but it is so important. It is so important to make sure that your mask is all the time on when you are inside that clinic, inside that clinical area. N95, and you wear your mask, your shields, your no belongings. I try to treat the reception as a pre-operative area, like in the surgeries, and the other what do you call, the surgeries are real surgeries, so minor OTs kind of thing. So that this is also, as I said, to upgrade dentistry in the eyes of public as well. Oh, the standard of care has to go up. I know it's not possible everywhere else, but if we as leaders of dentistry, if we show certain ways out, I'm sure others will slowly try to adapt. So once the patient is done, we try to get the Now, the most important feeling, I mean, it's the duffing procedure. During the duffing, what is happening is a lot of doctors getting infected. They're saying is during the duffing procedure. They're tired, they are uh, worked out, and when they're taking off the whole bloody PPE, the flying of the trajectory movements that can get the other person infected. So uh, there is this thing. Very, very slow doffing. This is extremely important in our scene. And what we do is, after duffing, it is placed straight into a detergent with a hypochlorite, 0.1%, very easy to make. You take a 5 liters of water and 1 teaspoonful of chlorine, and you try to, that will added benefit nice detergent. You soak that in for almost 1 hour in there, very slow, and that's how we go about. Then there you go. I mean, fomites needs to be taken care of course. So immediately after the patient goes out, we try to clean the area up with, of course, it's let the room, let it be for like 1 hour, 60 minutes. And again, 2 times, I want them to clean it up because it's not enough. So as I showed you the flow, as you see the system, now I'm going to show you the system. This is what we've done. All homemade with a technology, like the machine is from Ukraine, but rest of all the apparatus is made here by our engineers. It's ended. So, looking at, okay, then I started looking. I did it a little too early. I mean, just thinking out of my head, I felt, but there was a lot of talk going on. And I was very happy to find this literature, which just came out on 13th August, this little study, where it did show, yes, with the employing of these kind of negative pressure, we are able to get some kind of aerosol out. And the Scottish have just come out with a guideline of, if it's more than 10 ACH, your fallow time or interval between patients is 20 minutes, whereas if it's less than 10, then 60 minutes. If there is no ventilation, you are not supposed to do any aerosol generating procedure at all. And especially in a time like this, especially in a place like Kathmandu, where we are absolutely in red, we are actually not doing dentistry as of now. We are in a period of fallow period, let's say that. Now, ladies and gentlemen, at the end, I would like to give you a simple message, take-home message. I call it safety first message. And our main enemy here is aerosol. Of course, corona and the aerosol becomes a medium to fly. Let us not allow it to enter inside our systems, right? Let's use physics. Let's use experts. Let's not be, at times we dentists want to be everything. But let us take help of engineers and other guys to figure out the airflow and all that and evacuate these safely. And understanding the enemy and adapting to live with it is our new normal. If you'd like to find me somewhere, I'm on Facebook with Pande.Neil. Thank you very much for this opportunity.
Thank you, Dr. Neil. A wonderful presentation on how to minimize aerosol. Well, a few questions have popped in for you, and we'll need a quick answer so that we can proceed further. First is, do you reuse your N95s? Like you mentioned, that very difficult to get, masks available.
Yes. Yeah, absolutely. I mean, now we've got a BYD mask, NIOSH approved one we are getting here, but it has been very difficult, yes. So we use that, we use the surgical on top. We've been doing that. But on a lookout for N99. But, I always say, whenever it's difficult to breathe, that means it's working.
Right. Perfect. And the second question which is there for you is that is something like an electrical handpiece of any use for minimizing aerosols?
Well, I've been using electrical handpiece for almost 3 years now, and well, it has its water, it has its thing. So water directed towards the tooth and flying over. I don't think that's an answer. So without water, you may be able to use, I mean, slow speed or whatever, but. Uh, I mean, of course, rubber dam and all that, that's the main thing. Of course, we've been using that also for our certain procedure. But frankly speaking, we're trying to limit the time for patient in the operatory, and putting a rubber dam and doing the whole procedure is sometimes difficult for normal procedures. But yes, root canal and all that, we do use rubber dam.
Perfect. So we'll connect with you as we go further. Thank you, Dr. Neil. Wonderful, wonderful.